First speakers would Naoki Nakashima from Kyushu University. He is the director, professor of the Medical Information Center of Kyushu University Hospital, and also a visiting professor of National Institute of Informatics, Japan. He has been a specialist of diabetes mellitus for 25 years and simultaneously worked as a specialist of medical informatics for 13 years. He is a council member of Japanese Society of Diabetes Mellitus and the vice president of Japan Association for Medical Informatics. He focuses on disease management methodology of chronic disease from primary to tertiary prevention with sensor networking technology. He is also founding member or vice director of Telemedicine Development Center of Asia in Kyushu University. Short term is TEMDEC. TEMDEC is the most active institute for international telemedicine in Asia Pacific area. He is recently conducting cost-effective health checkup by sensor network and telemedicine with Grameen Group in Bangladesh. Grameen Group in Bangladesh will talk more about directly from Kyushu Nakashima. Okay, he is going to talk about the eHealthcare for disability in Japan. Dr. Nakashima, please go ahead.
Okay, thank you very much, Professor Yasuli. And my name is Naoki Nakashima. And maybe it's the newest agenda.
Excuse me, Dr. Okay. Soon please stop the sharing because we need to share our slides. If you don't stop the sharing, we cannot share our slides. Miss Sung Hee Ho, can you stop your slide?
Okay, we can see the slide. Please go ahead, Nakashima. eHealthcare for disabilities.
Yeah, according to the newest agenda, my topic is different from this slide. So I changed the slide name. So my slide name is eHealthcare for disabilities.
Okay.
Okay. And first, I want to definition about the disabilities. We have four of the disabilities. One is physical disabilities, as for example, after effect of stroke or leg amputation by diabetes mellitus. And second disability is visual impairment as blindness. And the third is speech disorder. And fourth is loss of hearing. This is, I think, disabilities group. This is Japanese population and aging ratio, past and future. This red line is right now. And Japan is the first runner of the aging society. And right now, the aging rate, that means population rate over the 65 years old, achieved already 65%, 1/4 of Japanese population. This is the highest rate in the world. And, it's will increase up to 40% in the 2060. This is actually maybe this time it's really difficult. It's going to be really difficult to support this society without any innovation. This means we should have more disabilities and dementias in future Japan. And also many world countries following us. Okay? And in this presentation, I would like to focus on disabilities, not on dementias. This is maybe next topics, I think. And this slide shows the target of this actually healthcare, e-healthcare system. Maybe main target is physical disability and visual impairment because a person with loss of hearing and speech disorder can use almost all ordinary devices. And many of disabilities are often able to use ordinary healthcare devices without without any effort. No. So, but in this presentation, I want to show additional or optional devices service for especially disabilities. Okay? And I want to make a definition of the health stage on this topics. Stage 1 is the health maintenance stage for healthy people. And stage 2 is prevention of NCD. NCD means chronic diseases for the little risky peoples. And the third stage is management of NCD, non-communicable diseases, for the affected people. Okay, stage 1 to stage 3 is in our focus. And I tried to make a classification of e-healthcare for disabilities. I arranged A, B, C, D, E. A is appropriate exercise, and B is balanced food, diet, and C is clinic visit. Actually, many people ignore to visit clinic, even they affected the chronic diseases. And D is daily support at home for the especially specific diseases, taking pills, rehabilitations, so on. And E is EICU at home. That means, for example, the person who affected by influenza virus, flu, or the person with severe diarrhea, they have to check their body and decide if they go to the clinic or not. Okay. And this is the first example. This is blood pressure monitor from A and D. This provide vocally explain how to use and announce check results. This is good for the person with visual impairment. And for stage 2 and stage 3 is DE. DE means daily support at home and EICU at home. You know, for example, with severe diarrhea, we have to check the dehydration. This weight scale contribute to know that the degree of dehydration. Okay, and this is electronic thermometers from Omro Healthcare. This is $120. This also provides vocally explain how to use and announce check results. Okay? And this is for stage 1 to 3, all of the stage, and good for visual impairment, and especially E. E is EIC at home. And this is weight scale named Inner Scan Voice from Tanita, Japanese company. This costs $150 US dollars. This is also the same function. Vocally explain how to use and announce check results. And I think this is good for stage 1 to 3, all stage, and for visual impairment, and the case B and D. B is balanced food, and E is, I'm sorry, this is E, I see at home. This is the package, attached case package we brought in the Bangladesh countryside to make the big scale health checkup and telemedicine in the countryside of Bangladesh. At this time, we just brought regular sensors, but we can easily replace this sensor to the sensor I just explained with the function for disabilities. And this slide explains about the function, the conversion function from letter information to voice information. We already have many applications in this, actually in Japan in world, and this is good for support for daily life and good for healthcare education. For example, this is to speak by Toshiba. Maybe you can hear this voice.
Hello, my name is Jane. I speak American English. Hello, my name is Jane.
This is artificial voice by machine from letter actually. This is American voice. And this is English voice.
Hello, my name is Charlotte. I speak British English. Hello, my name.
And this is from this is Chinese language. Oops, what? Wrong. Oops. Why?
你好，我是小芝，欢迎您体验东芝的中文语音合成技术。
These are very natural, and this is good for stage 1 or stage 1 to 3 and visual impairment and speech disorder. And the case with ABCDE, all cases. And you know, maybe you may know Google Translate. For example, just I want to try. Oh.
I did not sleep well. The wind was so strong yesterday.
Everybody can use this Google Translate function, right?
Nakashima-san, we cannot hear you.
Okay, sorry. Oh, I'm sorry.
Okay.
Maybe from here. I'm sorry. I want to introduce you about the remote sign language support. Maybe many of the world company already have this service, but Plus Voice Corporation is a Japanese company that they have two patterns of the service. One is face-to-face meeting with disabilities, and another is a meeting with remote place for the disabilities person. Okay. Sign language is as this. Okay. And this is also from same company, handwriting telephone for speech disorder and loss of hearing person with tablet. tablet PC. Okay, and this is a very new and very kind of innovative product, a kind of pilot study, I think. Almighty device for visual impairment or other, for example, speech disorders. This is just put with glasses, okay, from Israel company, Orkan. This device has camera, and for example, this lady cannot see the signal, but this camera recognizes the signal and notice this is red or green. Okay, and this is good for visual impairment and also good for speech disorder person because they don't actually okay, so and good for healthcare education for all stage disease and all cases, ABCDE. Okay, and also this is from Google contact lens with camera. They actually they provide the news on this beginning of this year, and this contact lens has camera, and in the future this contact lens can assay the glucose level by tear fluid for diabetes patients. This is really amazing innovation, I think. This is good for stage 1 to 3 and for the visual impairment and all of the case, ABCDE. Okay, this is summary. We have some application of healthcare for disabilities, and disabilities are often able to use ordinary healthcare devices. So they can use many devices already. But in this study, I tried to make classification of eHealthcare application for disabilities, and IT supports tremendous advance of healthcare for disabilities. And if you have, okay, that's all. And if you have any question, contact this mail address. Thank you very much for your attention.
Okay, thank you, Nakashima, Dr. Nakashima. Okay, so are there any questions? If you have any question, please raise your hand in front of camera so I can figure it out. So, Dr. Nakashima, I have questions. You talked about the visual impairment. So, does the glass are commercially available or just a research level eyeglass? Just I'm wondering about that.
This is available, commercially available.
So before one. Okay, this one. So like you have some picture in the screen. So commercially available one. Okay. So do you have any data from the satisfaction of the visual impairment people after
no.
using this one?
No, not yet. Yeah, I just collect the information.
Okay. Any question from? Okay, Dr. Waterly, please go ahead. Your question.
Yes, very interesting presentation, and I'm interested in the statistics for the aging society in Japan. I had mentioned that you were also involved in prevention of diabetes. Is that correct?
Yes.
Yeah. I just wondered, because I'm very interested in prevention of some of the conditions associated with the aging society, diabetes being one of them. I just wondered if you had any use of technology for helping to reduce the prevention of things like diabetes through the use of technology for self-management. For example, lifestyle tracking technologies. I use a Jawbone app, and I use other devices similar to the ones that you've shown in your project for measuring blood pressure. I have a wireless weigh scale, and I've used these very successfully to help prevent diabetes in my case. I just wondered if you had any programs in Japan, and if you are interested in working with me when I relocate to Malaysia on a program for diabetes prevention.
Okay. Today I just showed about the attached case sensor set in Bangladesh, but I also have the sensor network project in Japan, maybe from 4 years ago, 5 years ago, and I placed the sensor set and sensor network system at the home of diabetes patients, and they use these sensors. Immediately we can get the data to the database center, and from this data the computer system automatically make the recommendation to patients. For example, if the patient use elevator or escalator, the computer recommend next time use stairs instead of the elevator, like this. And actually, after this study, the diabetic patients improved their healthy status. Okay, and for the Bangladesh study, I also didn't show you about the results of this Bangladesh project. We also use the sensor network for about 20,000 people, and we provide telemedicine for 5,000 people among this. And these people improved their diabetes and hypertension by this sensor network with telemedicine service.
That's very interesting. Thank you very much. I would like to follow up with that later on. I'm at the moment working with Leicester Diabetes Centre on a project in the UK involving a sensor network. So maybe we can collaborate in the future on projects like this.
Okay, thank you very much.
Okay, thank you very much. Is there any questions? Okay, Seoul National University Hospital.
I am engineer in Seoul National University Bundang Hospital. Also, I am Professor Young Song Lee's student. So I usually studying healthcare or telemedicine. So thank you for your presentation. It's pretty impressive. And then I'm interested about OR cam. I already watched some Korean movie for OR cam. It's like it looks like Google Glass, but it's different from functions. I think it's a scanner. Scanning. It's like a camera. Scanning anything and then save data, and then later it detect realization, some realization everything, and then it help people. It's right. My English is poor, but do you understand my thing?
Actually, this is really similar to Google Glass, as you say. And but I didn't want to present all of the Google devices, so I want to introduce this one. Maybe, but this also really good device. But Google Glass is really progressive project or product, right? So we want to compare the two device function, I think. This is a good answer for you.
Yeah, okay, thank you very much.
Okay. Thank you.
Okay. Okay, thank you. Do you have any questions? Please raise your hand. I cannot hear. Okay. Thank you. Thank you, Nakashima, again
Thank you.
for your excellent presentation.